All right, so that was a short little video about our nursing program. What I'd like to do is to first start talking a little bit about the nursing profession. So you might have an idea of what you'd be getting into if you choose nursing as a major at a university. First, there's some really great information from the United States Bureau of Labor Statistics, very recent as of 2012, which states that the annual median pay for a registered nurse is over $65,000 a year. And what's even better, the jobs are plentiful. Currently, there are over 2,700,000 registered nurse jobs in the United States, and the projected job outlook is great, projected at 19% growth over the next 10 years, which is much faster than the average job. And the employment change in the next 10 years is going to be close to 500,000 jobs. So this is a growing profession, and it's one reason why many students are choosing the nursing field. And one reason for the increased job outlook is due to the increased emphasis of preventative care. Just recently I was reading an article how people with diabetes are having fewer and fewer heart attacks and dying less from heart attacks and strokes. And one reason that is because of the preventative care that's out there that people are receiving. The medications are better, they're seeing their doctors every 3 months, they're tackling those problems as soon as they get them. So that's one reason that we're looking at more nurses into the field. Growing rates of chronic conditions and diseases, asthma, diabetes, those are all diseases that are increasing. And the demand for healthcare services from aging baby boomer populations. As people as myself get older, we're going to need younger folks to take care of us. So what do registered nurses do? Well, first they record patients' medical histories and symptoms. They often do what's called intake. When you go to a doctor or hospital, a nurse is going to take your symptoms, your medications, that kind of thing. Registered nurses administer patients' medications and treatments. They set up plans for patient care and contribute to those existing plans, and they observe patients and record their observations. Plus, they consult with doctors and other healthcare professionals. They operate and monitor medical equipment. They help perform diagnostic tests and analyze those results. They teach patients and their families how to manage illness and injuries, and explain to do what they need to do when they go home from treatment. So if a patient is being discharged from a hospital, the registered nurse is going to give you those treatment plans to help you so that you're able to take care of yourself when you get home. There are many important traits that nurses need to have, but these are some of the top 10 that are most important. One of them is having a caring nature. If you're going to be a nurse, remember you're going to be taking care of people when they are at their most vulnerable, when they are sick, when they are dying, when they're just very sad, when they're in need of help. So it's really important that you are a caring person. Because as I said, these people are very vulnerable, they're very sick, they need your care. You must be empathetic and understand how they feel. If a patient is in pain, maybe they're snapping at you, maybe they're not happy, they're angry, they're crying, and you didn't understand it's not personal, it's the fact that they are in pain. You must be detail-oriented. You have to be able to read a physician's orders and have to pay attention to that. There are many different kinds of insulin bottles. You need to make sure that you're drawing that insulin from the correct bottle. If not, remember, you could kill a patient. You must be emotionally stable. Nurses often see things and hear things that are very disturbing, blood, mucus, body fluids, that kind of thing. You must be adaptable, and you must be physically strong, because remember, oftentimes you're going to be moving patients that are 200, 300 pounds. Not that you would have to do that yourself, but you have to be able to have a little bit of strength. You have to be a quick thinker and think on your feet. You must always demonstrate good judgment and be of an ethical nature. You must be hardworking and must have excellent communication skills. Oftentimes when I see new freshmen, I'm amazed by how shy and timid that they are, but yet when they graduate as seniors, they're the ones that are walking into the hospital rooms, into a room full of strangers saying, "Hello Mary, how are you feeling today? My name is Sue Miller, I'm going to be your nurse." So you're not just interacting with the patient, but you're also interacting with the patient's family. So why do you want to earn your BSN at Youngstown State University? Many reasons. So let's start talking about our nursing program here at YSU. At YSU, nursing is what we call restricted major, meaning that you have to take certain classes and get certain grades in those classes in order to be offered admission into the nursing program. You, as a student, are required to take a minimum of 10 pre-nursing prereqs, and all new students who enter to the university come in as pre-nursing majors. And again, you become a nursing major only after being officially accepted into the bachelor's program. Acceptance into the BSN program is based on 3 very important criteria. Your pre-nursing GPA, which is the 10 classes which we're going to talk about, must be at least a 3.0 or higher. Your cumulative GPA must be at least a 2.5 or higher, and that's for all the classes that you would take at Youngstown State University, not just those 10 pre-nursing classes. And the number of course repetitions in pre-nursing and nursing support classes. It's very important that you be able to master this material on the first try, and it's not like a failure of a class would necessarily keep you out of a nursing program. But remember, if you're doing 10 pre-nursing prerequisites and you fail 2 of those pre-nursing prerequisites, that's 20%. The nursing department doesn't feel at that point that you may be a successful candidate once you're in the program. So they may pass on you and look at another candidate. So that's very important. So again, it's three criteria: your pre-nursing GPA, your overall GPA, and number of course repetitions. So what exactly are those pre-nursing classes? And if you think about what nurses do, these pre-nursing classes serve as the foundation for your entire program. So you need 2 classes in human anatomy and physiology, which is anatomy and physiology 1 and 2. They both have labs. At some universities, we see students who have to have 1 course in human anatomy and another course in human physiology. Here at YSU, we combine the classes so that they're AMP 1 and 2. Some colleges call this class structure and function because it's not just the structure, for example, the heart and the kidneys, but it's also the function as well, so how those work together. And also it must be human anatomy and physiology, not mammalian anatomy and physiology. You have to have 2 college-level chemistry classes. 1 course, the content is general chemistry with the lab. The second class is organic and biochemistry with the lab. There are 2 college writing classes, Writing 1 and Writing 2. Writing 1 teaches a student about how to write a college essay. Writing 2 is actually the research paper and the argument paper, both very important. There are 2 courses in psychology that are required in the program: general psych, basic, freshman level psych 101. The second class is called lifespan development, and that is a piece of child, adolescent, adult, and aging psych all in 1 class. Some other colleges and universities call this class human growth and development, but at YSU it's called lifespan development. 1 course in statistics and 1 course in introduction to sociology. So those are the 10 classes that make up our pre-nursing prerequisites at YSU. Some things to consider. Our nursing program is always 3 years, but some students can do pre-nursing in 1 year, and some students take longer than that. So it's difficult to tell, for me to address anyone as to whether they're going to be able to complete the BSN program in 4 years or whether it might take 5 years. Just so that they know, the nursing program is 3 years, but we can never tell you how long it's going to take for you to do pre-nursing. Some students can do it in 1 year, some students opt to do it in 2 years. If it takes you longer than 1 year, that might be because you didn't have the necessary high school classes. For example, high school biology and high school chemistry are mandatory before you begin taking our lab sciences. It may be because of your ACT or SAT test results that might not indicate that you're college ready, or your placement test results that might not indicate you're college ready, and you might need some pre-college math or pre-college writing or reading and study skills class. And you do need to know that the traditional BSN program is a full-time daytime program, which means that you must be a full-time student and the bulk of the program is offered during the day. Once accepted into the BSN program, you are required to complete Cpr Certification, which is really available anywhere, the American Red Cross, the Heart Association. You are required to do a physical examination. You will be given a list of immunizations that you're required to take. You will be fingerprinted and drug tested. And you will be subject to an annual criminal background check and random drug testing, which is very important, as the drug testing will ensure that you are able to complete your clinical hours. Admission applications, and remember, this is also very important. Admission to Youngstown State University and admission to the nursing program are really two separate things, because remember, you start off as a pre-nursing student, so you have to take those classes first before you're actually admitted into the nursing program. However, if you're on track to complete your pre-nursing classes, you must actually physically apply to the nursing program. And those applications are available always from October 1st through the third Tuesday in January, if you are planning to start the following fall. So it's almost like you have to think about applying a year ahead of time before you want to start the nursing program. And applicants get ranked on that pre-nursing GPA, which is required to be at least a 3.0 or higher. So you want to do really well in those 10 pre-nursing classes so that you are accepted into the program. And our nursing program makes available 100 seats every fall for you. There are times that we do accept more than 100 if there are more than 100 applications or applicants that are over a 3.0, but that's really determined on an annual basis. Once you have it admitted into the program, some of the foundation classes in nursing are health assessment, which is when you actually really begin to assess a patient, which sometimes you can just visually do by looking at a patient. What is their eyes, or how do their eyes look? Are they dilated? Are they red? What is their skin doing? Are they gray? Are they sweaty? Are they pink in the face? Are they flush? What is their breathing? So sometimes you can just tell by looking at a patient when you're assessing them, but other times you're looking at blood pressure, blood testing, temperatures, that kind of thing. Pathophysiology, my favorite description of this class is anatomy and physiology gone wrong. Pathophysiology is the study of human diseases. Another course is pharmacology, which is the study of drugs and drug interactions. At Youngstown State University, you're going to get lots of clinical experience. You will have 9 clinical rotations. You will have professional nursing 1, 2, and 3. And those rotations, those clinical hours, are really for the general med-surg type areas: cardiology, cancer, gallbladder, kidney disease, general items like that. You have 5 specialty rotations. You will have 1 in women's health and OBGYN. You will have 1 in pediatrics. You will have 1 in mental health nursing, 1 in critical care nursing, and 1 in nursing in the community. And your final clinical experience comes as you're a senior, right before you graduate, in your final semester at YSU, which is called Nursing Transitions. And that's a great class where you actually work with what's called a preceptor. Your preceptor is actually a nurse in a hospital, and it is hopeful that you'll be able to work in an area that you might have interest in. So you might be working in a neonatal unit, or you might be working in a neurological unit, or something like that. You might end up in a general floor or the operating room. But you do get lots of clinical hours here at YSU, which will prepare you to be an excellent nurse after you graduate. And I think one of the most important things is that our pass rate, our Nclex pass rate at YSU is very, very high. For 2013, it was 95.31%. Which means that of the students that took the Nclex who graduated last May, over 95% of them did pass the Nclex. Just so that you know what the Nclex is it's a competency-based state examination, and it is, as the bar exam is to becoming attorney, a state licensed attorney, the Nclex is to a nurse that you are able to receive your licensure from the state of Ohio. Nclex actually stands from the National Council Licensure Examination. So that's very important as well. And that concludes my presentation, and I would be happy to take your questions if you have any at this point. Okay, I have a question from Indiana. Can I get a 2-year nursing degree from Youngstown State University? The answer to that is no. There is the 2-year degree. I'm assuming you mean an associate's degree. The traditional degree that we offer at Youngstown State University is the BSN, which is Bachelor of Science in Nursing. So unfortunately, there is no 2-year degree available here at YSU. Okay, any other questions? I have a question from New York City. What's the difference between an RN and a BSN? Well, an RN is the basic credential, which is the registered nurse credential. So you can become a registered nurse a couple different ways. Besides the bachelor's degree, there might be a diploma program, which is traditionally like an 18-month program, or you might look at an associate degree program, which is traditionally a 2-year program. But this is the bachelor's degree program. And we're finding that more and more hospitals are looking for the bachelor degree nurse. That's very important, especially when you're looking at a magnet hospital. So some of our hospitals locally are saying if they hire a nurse that has an associate's degree, well, it may hire them, but they'll tell them within 5 years you have to earn your bachelor's degree. Many of the students that I talk to at this point are looking at their BSN, but looking ahead. They're looking to be nurse anesthetists, nurse practitioners. You must have your bachelor's degree if you want to progress into those programs. So that's very important. I would certainly recommend a bachelor's degree program for anyone looking at a program. Okay, from New Jersey, I believe. How long is the program? Well, as I said before, the actual nursing program is 3 years, all right? But pre-nursing could take you 1 year, 2 years, however long it takes. Remember, there are some things that we can't control. We can't control whether you go full-time or part-time. We can't control, that you pass all your classes. We can't control if you have to step out a semester, maybe because of an illness or something like that, which is why we're a little hesitant to say it will take you 4 years. I can tell you that the nursing program is 3 years, but you have your pre-nursing on top of that, so that's very important. and another question from New Jersey is how long will it take to complete the pre-nursing prereqs? Again, it just depends on how long you go through them. It could take a year, it could take 2 years, it could take longer than that, depending if you're going full-time or part-time. Okay, hope I make that clear. If not, please let me know. Another question from Arkansas. What requirements do I need to meet to be admitted into the program? We went over those, and it's having your 10 pre-nursing prerequisites completed with at least a 3.0 or higher. Your overall GPA has to be at least a 2.5 or higher, and no more than 2 course repetitions in the pre-nursing prereqs or the support classes, which include microbiology, food nutrition, and contemporary nursing. So that's very important. And remember, regardless of whether it's a YSU program or a program throughout the United States, you must have a decent GPA. Because if you're a BC student, unfortunately, you're probably not going to get into a nursing program. You're really looking at a very strong GPA, especially in the sciences. That's very, very critical that you do well in your lab sciences. Okay, I'm trying to see where this next question is from. Florida, it looks like. How many students are accepted into the program? Well, last year we offered admission to 120, and I would not say that we would do that every year, but we had a very large applicant pool last year, and equally they were a very qualified applicant pool. So we did not want to turn too many students away, so we did offer admission to 120 students. We can always guarantee 100 seats every year. Hopefully, if we have 103 that are accepted, we will be able to take 103. So again, it depends on the number of the applicants and the quality of the applicants. That's just as important. Okay, let me see where this next question is from. I hate to squint, but I have to check. Idaho? Okay, what requirements do I need from high school to be accepted into the program? Well, it's not so much high school grades, it's the high school classes that you take will actually get you through the prerequisites in a little bit quicker of a time. So it's not that we tell you that you must have at least a 25 ACT. Really anybody can start as a pre-nursing student. It's how well you do in the pre-nursing classes that determines whether or not you will be eligible for the program. We talked about the Nclex rate, which was, I believe, very high for the state of Ohio. One question that's coming in is about Nclex review classes. Within the program, you will get Kaplan testing, and that will, I believe you get that at the end of every semester. And you will progress, we really need to pass those Kaplan tests in order for you to move on to the next semester, so that when you go to take the Nclex, you are really prepared, prepared to take the Nclex, and more importantly, prepared to pass it. You can take the Nclex however many times you want, but I believe, is that correct? But certainly there's a charge every time you take it, so you really want it, you know, get that test passed so that you can begin working. Okay. I don't believe I have any other questions at this point. Is there anything else I would need to add for our viewers out there from my gallery out here? No? All right. Well, then I would like to turn this over to Suzanne Smith from Dental Hygiene. Thank you for your time. Please, if you have any questions, feel free to contact us. Again, my name is Sue Miller. I'm an academic advisor. You will see me twice in your career at Youngstown State if you are pre-nursing. Once as you're coming in to be advised into pre-nursing, and lastly, I'm the one that does the senior sheets and the graduation audits and clear the graduates so that the chair of nursing and the dean signs off on that so that you are able to graduate. So I'll catch you twice, coming and going. So good luck in your careers. I hope you consider YSU for your nursing program. Thank you.